So the rationale for conducting this study was to look at the Canadian experience with TURP and the other surgical therapies like TURP, namely in 2023. So working with sort of key opinion leaders in every province to get the code. So number one is to show people across the world outside of Canada that although there is a universal healthcare principle, each province has its own sovereignty on choosing the code and the reimbursement for every technique. In this case, TURP, the staple BPH procedure done by all urologists. So that's kind of our bread and butter. Used to be the biggest number in terms of surgical therapies back in the 80s. Then medications changed that. But nonetheless, to see how that did in 2023, and then also compared to 2012. So 13 years have passed. How much change and reimbursement has there been to meet with the cost of living index? Did it match? So we wanted to look at that. And then also to really team into some of the more advanced TURP techniques or green light for more anticoagulated patients who requires more training and a little bit longer OR time. And ultimately the HoLEP and enucleation technique designated standard of care, especially in larger prostates, where we know only about 5% of urologists are offering or have gone to do the necessary extra training as a fellowship when they come back and to initiate into their program. Is it equitable compared to some of the other techniques that are there? And to see, is there a designation? So that was the purpose of this, is to look and show, what the differences are in Canada. How did things change over 11 years? And is there a designation and a respect or not saying an honor, but is there an additional fee for the quality, the skill set, the extra anxiety, the ergonomics, these longer OR times for these more challenging, more difficult procedures, which in the States, I think they have different modifiers for those more challenging. So in this case, HoLEP, anatomic enucleation, I think everyone in this who's listening will agree that is by far one of the most challenging procedures. Is there something specific for that procedure amongst the 10 provinces? The first would be that amongst the 10 provinces, there's 10 different fees for a TURP. And that's remained the same from 2012 to 2023. And some big variances of at least 20, 30% differences between provinces. That's just for TURP. From 2012 to 2023, there's 2 provinces that had the same fee structure for physician that had not changed. The others were all, single-digit percentages. So there wasn't, compared to the cost of living index, it was far inferior. It did not keep up with the cost of living index for the staple urological procedure. So I think those are our main findings just for TURP. And we look at green light and anatomic enucleation like HoLEP. There's only 3 of the 10 provinces that had a designated code or a small modifier, such as in Quebec, they have an additional $100 if you have at least 2 or 2.5 hours of anesthesia time. Otherwise, same code as TURP. So I think those are the key findings, is that there's a disparity, that there's not a increase of reimbursement across all provinces in Canada that met up or was at par with the cost of living index. And that, when you look at in the States, they have different CPT codes for individual missed TURP enucleation that have, I think, appropriate RVUs or reimbursement for those levels of challenges. That is not being seen in the global components of Canadian healthcare.